Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. As I said, February is American Heart Health Month, and there's a lot of cardiac causes of chest pain. But my next guest is Dr. Aletia Farmer, who is an internist and my colleague at Family Practice Associates, and we're going to talk about non-cardiac causes of chest pain. Now, one of the top of, that I think about a lot is GERD. What is it, and does it cause chest pain?
Well, GERD is one of the most common causes of non-cardiac chest pain, and we see it a lot in the clinic. And what it is when your lower esophageal sphincter, which opens up between the stomach and the esophagus, is loose or weaker. It will allow that acid to come up from the stomach into the esophagus. It's very easily diagnosed, usually with just a good history. And a lot of the symptoms include when they come in with the heartburn, is kind of that classic with the chest pain. They'll sometimes have nausea, regurgitation. They'll sometimes even talk about feeling a lump in their throat or trouble swallowing. And oftentimes we can usually rule out cardiac chest pain with just that history alone.
Now, let's say they do have GERD. Are there some things they can do about it?
Yes, sometimes if it's just intermittent, they have triggers, we put them on they can take an antacid just like Tums. If they have it more frequent, then we sometimes put them on an H2 blocker, and that would be, that would suppress that acid, and it's more commonly known, Pepcid, where they could take that twice a day. If they continue to have breakthrough symptoms of the GERD, then they should see us and get a prescription dose of a PPI, which is a protein pump inhibitor like Nexium, Prilosec, or Protonix, and we put that on for about 6 to 8 weeks to see not only to suppress the acid, but to heal the lining of the esophagus and the stomach.
So what's some other causes of chest pain that are non-cardiac?
So another common one is called costochondritis, and that one is where the cartilage that's in between our breastbone and sternum and our rib cage, that gets inflamed, and that is commonly found sometimes even in younger people if they overdo it in the gym with repetitive exercise, or they push a couch. Other things that cause that is sometimes that happens after people get a respiratory illness.
Okay,
as
now
well.
You mentioned respiratory. There's also some lung things that can cause chest pain.
Yes, and a couple of things, two that we are really worried about, which are medical emergencies, would be what's called a pulmonary embolism. And that's when a clot usually develops in the lower extremity and then it goes up to the lung. Oftentimes then it will actually block the pulmonary artery that takes the good oxygen blood and sends it to the heart and to our organs. Those people will then not be able to get enough oxygen, and they'll oftentimes come in with sudden shortness of breath, non-cardiac chest pain. That's also hurts when they take a good deep breath. And other times they'll be tachycardic, sweating, and they may even pass out. That needs prompt treatment to break up that clot.
Now you mentioned pain when you breathe in. It could be a pulmonary embolism. It could be something as simple as pleurisy also, which is other non-cardiac chest pain.
Yes, and a lot of people hear that word pleurisy, and that comes from infections and like flu, or it can be from pneumonias, or fungal infections and TB, which we don't see that often these days. But even people who have autoimmune diseases like rheumatoid arthritis or lupus can come in and have pleurisy.
Okay, now I've also seen maybe shingles can cause chest pain and sneak up on you.
It's a sneaky one, but it's a lot of times people will come in and they'll have that heartburning, or they'll just be like feel sore, or maybe even feel like they're coming down with the flu. And you always do need to check the skin and the chest wall. And if you see those little crops of vesicles, then you know that you're probably dealing with shingles and need to put them on an antiviral.
But the bottom line is chest pain is not something to be ignored, because it could be cardiac. It could be one of these things. More likely it is one of these things, but you need to be evaluated if you're having chest pain.
Most definitely. I mean, it's a very, very wide differential when we're thinking about people that come in with chest pain.
It's great information. We appreciate you coming in, and thank you for your knowledge.
Thank you.
We'll be right back.